Hey guys, Dr. Shook here. I hope you're doing well today. Today we're going to talk about a topic that comes up a lot, and that is brain fog. And brain fog has a lot of different causes, but staying with the theme that we've been covering, we're going to be talking about how the digestive tract can cause brain fog, okay? So especially if there's inflammation in the gut. And I hope you guys are doing great today, by the way. It is Friday, so I'm always happy. But I want you guys to know that if you like this, just kind of like I've been doing with the past few live streams we've done, if you guys like this topic, please do share it. If you don't share it, then I'm going to talk about something else. But right now I'm staying with the gut. I'm staying with how that affects different areas of different complaints that we commonly see in the office, which are metabolism, brain fog, a lot of the most common symptoms of fatigue. So if you guys like this and like what I'm talking about, please do share it. I'm using that to look at the shares as votes for yes, stay with these types of topics. If not, I'm going to move on to another topic soon. But I appreciate you guys a lot, and I appreciate you sharing and also commenting. Guys, if you have questions as we go along, I might not be able to answer your questions right now, but we will definitely be able to respond to you within the comments, my staff and I, at least at some point. So please do post comments if you have questions. Again, if I can't respond to you right now, then just leave your questions and comments, and we'll get back to you as soon as possible. So let's talk about how the gut can cause brain fog. And guys, this goes much further than brain fog. Actually, we're going to be talking about how this problem with inflammation in the digestive tract can actually contribute to neurodegenerative diseases, like Alzheimer's disease, okay, for example, is one. And guys, if you don't know this, we are facing an epidemic of, really unprecedented proportions with these neurodegenerative conditions in the world as a whole, not just in the U.S., but this is very, very serious, and this information right here is something that's really important for you guys. So I'm going to be expanding on that, but I want to go ahead and let's get into it so that we can talk about how gut inflammation affects the brain. Okay, so this is how our story goes today. We've got a digestive tract here. You guys see my wonderful drawings. I know that you guys love them. They are. I hope you can recognize that that's supposed to be a large intestine, and this is supposed to be the small intestine, and I call this the gut collectively. And inside these little purple things, I was just running out of colors. So these little purple dots are meant to be inflammation. So inflammation from anything. It could be infections, inflammatory bowel disease, dysbiosis, a fungal infection, a parasitic infection. It could be a lot of different things here, guys, but inflammation in the GI tract, which is super common today, is present. Now, guys, when you have inflammation in the gut, it doesn't stay there. It gets into the circulatory system. You like my circle that represents the entire vascular system of the body? This is the circulatory system. This is meant to be blood flowing through it. This inflammatory chemistry in the gut gets into the circulatory system. When it gets into the circulatory system, it goes throughout the body, okay? When it goes throughout the body, and guys, I want to just say, I'm talking about cytokines primarily here. Now guys, remember, I talk about these a lot. These cytokines are, basically we're going to use the word inflammation to describe them, but they're proteins produced by the immune system. They're chemical messengers that help with the types of immune cells that are actually formed or created, okay? So cytokines are these inflammatory chemical markers made by the immune system during an inflammatory response, okay? Or during inflammation. So these cytokines, this inflammation, gets into the bloodstream, goes to the bloodstream. When it's in the bloodstream, it does go up to the brain. Now, what happens is, when it gets to the brain, this is our brain, there's this thing called the blood-brain barrier. This barrier system keeps things out of the brain that we don't want to be there. Okay, it's a barrier that selectively lets things through. So if these inflammatory chemicals, these cytokines, can very readily and easily cross into the brain through the blood-brain barrier. So they can get through. Okay, now this is not good. It's not good to have high levels of these cytokines in the brain, because what happens when these inflammatory chemicals, which are the purple things, get into the brain, is that they activate, okay? They activate these wonderful things here called glial cells. Now guys, all you need to know is this. Glial cells are part of the immune system of the brain, okay? And there are a lot of glial cells in the brain. And they are very, very protective of your neurons or your nerve cells, okay? So these are immune system cells, glial cells in the brain. They're very protective of the nerve cells in the brain. So protective that whenever they're stimulated, they oftentimes create a lot of damage, but they want to make sure that whatever they're reacting to is gone. Okay? So they will create some collateral damage. But here's what happens. This inflammation, when it gets there into the brain, it activates these glial cells. When they get activated, what ends up happening is that they produce their own inflammation. Okay? They produce inflammation on their own that's separate from the inflammation that was coming from the gut. Okay? So there's more inflammation in the brain. It activates a system in your body that's very inflammatory, that can cause a lot of tissue destruction. It's called the nitric oxide system, okay? Just know that all this inflammation stimulates these cells, and they end up doing a lot of damage to the neurons, or the nerve cells in the brain, the neurons, and they can actually cause cell death to the neurons and the nerve cells in the brain. So for one thing, while all this is occurring, there's definitely a loss of efficiency of firing of the nerve cells from one to the next. That can cause brain fog right there. But really longer term, what we're looking at is loss and death of nerve cells in the brain. Now this general term of like the activation of these nerve cells, or the activation of these immune cells, these glial cells, is typically what we call it like gliosis. This generalized activation of these cells. And this, guys, we know that that's been implicated, for example, in neurodegenerative diseases, brain degenerative diseases. In particular, Alzheimer's is one of the neurodegenerative diseases where we've seen this. So guys, this is incredibly important. And I want you to know something. So we're talking about the gut, right? We've been staying with our theme of the gut and how the gut impacts so many different things, because so many millions and millions of people in the United States alone have all this GI tract inflammation that can create all of these problems for you. And a lot of times people are looking at the symptom rather than more of a driving factor, right? But here's the thing to keep in mind. Any inflammatory process that's occurring throughout the body can create these cytokines, or these inflammatory chemicals that will be in the circulation that could cross into cross the blood-brain barrier into the brain and create this problem. So it doesn't just it's not just the gut that can create this and set this up. So it's really important that you guys understand that your gut health is it's critical for your brain and your brain function. So if you have brain fog, could that be caused by inflammation? And I'm going to tell you that the most common problem that I see, you guys know, primarily what I work with is thyroid dysfunction, autoimmune thyroid dysfunction, and in particular Hashimoto's. But guys, we find very, very commonly that the cause and the driver of brain fog and of a lot of the symptoms and problems that we're seeing is due to inflammation. It's not due to thyroid dysfunction. It's due to inflammation, and the inflammation is creating a host of other problems throughout the body. So guys, where do we start with something like this? Like what can we do about it? So you guys know, if you've been watching me, what am I going to say? Right? What am I going to tell you? Where are we going to start working on this? Okay? Where are we going to start? We're going to start with, well, first of all, if you can, you want to see someone and you want to get worked up to figure out what's going on, right? I'm not telling you not to see your doctors. See your doctors, get worked up to figure out what's going on, okay? Get worked up, find someone, work with someone that can help you figure out what's happening here. But if we're trying some things on our own, we're going to go with diet first, right? Diet is absolutely going to be the first thing that we do. And what are some good diets out there? There's a lot of good diets, but in general, what I've found clinically, and we've used a lot of different diets clinically, is that an autoimmune paleo-ish, like an autoimmune paleo-like diet, tends to remove a lot of the inflammatory foods from your diet. Okay, and it can tend to help improve gut function and decrease some inflammation. Now, a lot of you guys know we have been working on and refining our dietary approach for years and years, and we have a program called the 6-Week Hashimoto's Transformation Program that has a dietary protocol that we've utilized clinically that we've had great results with. And that's also an option for you guys, that you can consider doing something like that. And our program even has dietary, it has lifestyle recommendations, and we guide you. I actually teach a class in there where you do an assessment of yourself, and we help you figure out what nutritional supplementation might be beneficial for you. Because you can use nutritional supplementation in combination with diet, which is a great thing to do, to help heal the gut, decrease inflammation, and actually work on a lot of these other potential mechanisms and things that are creating issues here. You can utilize nutritional supplementation to help decrease the inflammatory process. So we kind of help you with a lot of those things through our program as well. But diet is going to be the first place to start, right, guys? That's going to be the first place to start, and that's going to be really critical for a lot of people, because a lot of people are still eating standard American diets. They're eating highly processed foods. Guys, that is going to be a big problem for your healing and your recovery, especially if you're having digestive tract problems. Okay, you cannot go wrong with better nutrition. All right, so I wanted to share that with you guys. So again, bad gut can cause brain inflammation. Basically, the inflammation can create brain fog, but it can actually lead to death and degeneration of the nerve cells of the brain, leading to neurodegenerative diseases. We know that things like this have been implicated with conditions like Alzheimer's, right? Very much so. So guys, I hope that this has been helpful. Listen, if you're trying to figure out a thing to do, place to start, you can try like an autoimmune paleo type of diet. If you want to try our 6-week Hashimoto's transformation program, it's appropriate for people. It doesn't matter if you have Hashimoto's, but if you're autoimmune, our program's focused on balancing blood sugar, decreasing gut inflammation, and really improving inflammation systemically. And it's a fantastic approach. You can go to thyroidgiveaway.com. We give it away once a month. So coming up at the end of this month, we're going to be giving away we'll give away our Hashimoto transformation program to one person. They get access to for 2 people, because we like for people to go through this stuff through our program in pairs if possible, because they have a partner. But we do have a private Facebook group that is dedicated to people going through our program. But guys, if you go to thyroidgiveaway.com, you can go there and you can register for free to enter and win it. But then you get, right now we're doing a promotion. I'm not going to tell you any other details on it, but if you enter to win, you'll see what the promotion is after you've entered our giveaway. And that's thyroidgiveaway.com. And you can actually get started with that program today if you wanted to. But guys, diet's a reasonable place to start. Brain fog is absolutely can be inflammatory. There can be other mechanisms, but guys, this is so common. I can't even tell you how many times I see this in practice. And it's really important to know that there's a lot that you can do about it on your own. So I'm going to keep teaching you guys. If you keep listening and tuning in, I'm going to keep trying to educate you as much as I can on how you can help yourself and how you can take your health back and become your own advocate, be better partners with your healthcare providers too, okay? So guys, please do share the message, help other people to help themselves, help us spread the word, and please do keep tuning in, and I'll keep teaching. But I appreciate you guys. I hope you guys have a wonderful weekend. Post your questions, post your comments below, and we will definitely get back to you and try to give you some help and some guidance. But guys, I just can't tell you how much I appreciate you, and I hope this helps to add quality and to your life and really help you out. Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great